As a healthcare leader, what have you done to be able to care for the caregiver? You know, those individuals that spend countless hours at the bedside providing compassionate care to patients and their families. It's not that easy. I mean, every day there seems to be something new, a new procedure, a new policy, a new checklist, or something more that you need to fill out on the electronic medical record. As individuals that work at the bedside, they are tired, they are worn out, and they are frustrated. And as a leader, how is it that you empower and motivate those individuals to provide great care on a daily basis? It's really hard. So I'd say to you, there's one thing that you can do that I think that will really help, and that is this. Create a fun committee. That's right. Oftentimes we create committees and people see it as just another thing that they have to do. But if you tell them that we're creating a committee just simply based on creating more fun at work, I'm sure you'll have lots of volunteers. And it's not that hard to do. Honestly, as you put this committee together, ask for volunteers. Ask for individuals. Make sure that every discipline within a department is acknowledged. When you do that, come up with programs, creative ideas, things that will make the workday fun. And I know what you're thinking. When we create these kinds of things, reward and recognition programs often require prizes, and those prizes then cost money. And we don't have money. There's no money in the budget for a fun committee. But there are ways to be able to provide caregivers with things that they will appreciate and cost no money at all. What am I talking about? For example, if you start a reward and recognition committee and somebody say they get the most kudos from their fellow colleagues, how do you celebrate them? Well, it's easy. You tell them that person that they get to choose their lunch break, what time they get to go to lunch. I mean, we all know that nobody wants to go to the 11 o'clock lunch. It's too early. I'm not even hungry yet. Or that 2 o'clock lunch where you're about to pass out before you even get a chance to put something in your mouth. That's a neat little way, a little prize that you can give a hardworking caregiver that they will appreciate. Or perhaps if you work in a place, say the emergency department, let that person for an entire week pick where they work. What section of the emergency department? Will they work in triage? Will they work in trauma? Will they work in the acute area? That again is another way of providing a caregiver with an opportunity that is positive for them and yet costs zero to no money. I will tell you that every day we are challenged as healthcare leaders to continue to empower and engage our bedside caregivers. And this is just one little way that you and your organization can create an environment where people want to come to work every day. Caring for the caregiver. Remember, empower, energize, and engage.